Maculopathy is a diseased condition of macula. Macula is the most sensitive point of retina, and retina is the most important layer of the eyeball that lies inside the eyeball, and macula is the point where light rays, which is reflected from the object, get converged. And after this convergence, the steps for developing the sense starts. That is, different types of reactions such as photochemical, then electrical, then nervous, like that. And the result of these actions, these reactions, is the formation of an impulse. That means an object which was purely material in the outside of the eye, that becomes a biological factor when an impulse is formed. In short, an impulse is a small biological variation of an object which is lying outside, and this impulse is converted to sense in the brain. So, any defect in this macular area will be directly connected with the formation of impulse. That will not be possible. So, a visual problem, visual defects is very confirmed symptom of maculopathy. And since the macula as such is involved in a serious way in the case of maculopathy, possibility of total loss of vision is that also is there in this case. So, it should be considered with high seriousness. Then this may happen in different conditions. The most important reason is diabetes mellitus. And diabetes, if it is chronic, there is a possible ocular complication, that is retinopathy. And this maculopathy is a complication of this diabetic retinopathy. And we can always again say as a part of retinopathy. And in maculopathy, the main pathology is the accumulation of fluid in the macular area. And actually macula is avascular. There will not be any blood vessels inside the macular area, because once macula is vascularized, all these reactions will not be possible. So, in the case of maculopathy, what happens? The vessels will be encroaching to the macular area. In many cases that happens, because in retinopathy is a that is a complication of diabetes. The pathology lies in the vascular system, especially microvascular system of the retina. So, as a result of this pathology, there will be some changes in the vascularity of retina. That is why vessels are being developed, and it is encroaching the macular area. And then there will be leakages from these vessels. And sometimes what happens, this fluid may be accumulated in the macular area. Then that particular condition known as macular edema, which is very common in retinopathy. In some other cases, it will not be the fluid will not be accumulated in the macular area. Instead, it may be leaking to the interretinal layers sometimes, and sometimes it may be leaking to the anterior portion, that is this vitreous gel which is lying anterior to the retina. So, maculopathy may not be developed. If it is accumulating, if it is focusing on the macular area, that particular condition is known as maculopathy. And then visual defects, visual problems will be, it is a compulsory outcome of maculopathy. The main symptom is always loss of central vision. That means in the visual field, the total area where we get the vision, and in the very center of that field they get dark area which is not visible. That is known as central scotoma. That is the most important symptom of maculopathy. Then other symptoms are some distorted vision. That means there will be some, if it is a straight line, suppose a straight line, it will be seen as wavy or distorted. It may happen in both vertical and horizontal level. Then this may reflect in the shape of the object also. If it is round, it may be seem to be squeezed. That also may happen. And another symptom is there will be pockets where vision is not gained, missing areas. And again, once the macula is getting filled with fluid, gradually the cells get degenerated. Then macular degeneration will be the next level. Then vision problem will be more serious. And the size of the object also may be varying, not only shape but the total size also may be affected. Sometimes it is seen to be small in size or yellowish in color generally. That type of changes, different types of visual changes are seen in maculopathy. So it is considered to be a very serious ocular condition which directly affects the vision, and if not treated in the correct time, it will lead to total blind. Patient become blind totally. That is why it is considered to be an alarming condition. But it doesn't mean that diabetic retinopathy is the only reason for maculopathy. It may happen in so many other situations also. Diabetes is the main reason usually seen to be happening, but any pathology, any condition that leads to macular pathology may lead to maculopathy. For example, macular edema other than diabetic edema. It happens because of so many other situations, just like even stress and tension. In such a condition also macular edema will be there, and gradually it will lead to maculopathy. And even traumatic conditions, sometimes trauma on the eye, which gives its impact on the macular area. Then also high level macular changes will happen and it will lead to maculopathy. Maculopathy means just a diseased condition of macula, in which this fluid accumulation is a main symptom, and it will change to other pathological changes gradually. So any situation which will lead to macular damage may develop maculopathy. We can use the term maculopathy. Now coming to the Ayurvedic side, macula is the seat of Pitta, because that is the place where light rays are converging and different types of actions are developing. So this is we can say this is the actual seat of Alojika Pitta. Alojika Pitta is a fraction of Pitta which is confined to ocular system. And then this is the functions of this Pitta is becoming defective because of the involvement of some other doshas. That dosha is Kapha in the case of fluid accumulation. So we can say in general, maculopathy is a condition where Pitta and Kapha are equally important. And that is why the treatment becomes a little risky. The treatment of Pitta alone is very, it goes on a single line. And the treatment of Kapha also will be in a single line. But it becomes a Kapha Pitta condition, the treatment will be bifolded. We have to consider two different aspects equally. So we have to release the fluid first, we have to drain out the fluid, and then what happens, the Pitta will be becoming activated. So we have to keep the Pitta not being dried out or more vitiated. So the treatment should be charted out in such a way that to drain out the fluid which is accumulated, that is Kava Shodhana Chikitsa, and to maintain the action of Pitta in its normal way. That is the basis of the treatment in Ayurveda. But once the fluid is drained out, that is very easy. There are so many ocular treatment procedures to remove the fluids from the accumulated sites. But what happens, since the problem is not, if the problem is not localized to that area alone, that means if it is a complication of other conditions just like retinopathy or diabetes or even hypertension also may lead to maculopathy. In such a situation, the basic reason or the causative factor or the trigger factor is remaining there. So it will recur, no doubt it will recur. So after the treatment is not completed at that level, after draining out the fluid from the that accumulated area, that is not a treatment at all, that is only temporary adjustment. Possibility of further recurrence, further accumulation is there. So that is the tough area of the treatment. For that we have to normalize the blood flow, to control the blood flow so that further accumulation should be avoided. Then only we can say treatment is successful. For that we have to consider various aspects. What was the reason for this fluid accumulation or leakage from the vessels or encroachment of the vessels to the macular area? That should be considered. In that level only we can avoid further possibility. So for that oral medication is absolutely necessary. If that accumulation is directly from the fluid due to the changes on the vessel walls, then the measures to avoid further recurrence will be maintaining the vessel walls, not to make any changes in the blood. If the leakage is due to the thinning of the blood or some blood changes, then we have to maintain the property of blood. According to Ayurveda, Raktha Dhatu. Like that, the aim of the treatment changes according to pathology behind this problem. So it may be Shodhana Chikitsa, it may be Anulomana Chikitsa, it may be Shamana Chikitsa. These three may come or may change from one person to another person. If the person is, for example, having high cholesterol, there we have to adapt some treatment measures or some procedures to remove the blockages or to avoid the accumulation of the deposits. For that, we have to adapt that type of treatment procedures so that there will not be leakage of fluid to the macular area. And if that is only because of the blood changes, leaking is happening, then we have to maintain the properties of blood. For that, Pitta Shamana Chikitsa is more important. In other words, we can say Rakta Shuddhikara or Rakta Prasadhana. The terms are like that. That type of treatments are necessary, that type of oral medications also are necessary. In short, if you are analyzing the root cause for this pathology and taking remedial measures for that, the treatment will be successful. We have already seen that there are various conditions which leads to this particular pathology in the macular area. So the aim of the treatment should be to avoid this pathology. So for that we have to consider the root cause behind that. So in short we can say among the root causes, one is diabetes and one is other blood changes or vascular changes, like that. So we have to consider these points, and to maintain the circulation will be the first and foremost step to avoid the development of maculopathy. If it is not due to a trauma like that, that is another thing, it cannot be prevented by taking any other precautionary methods. So, if it is due to a systemic condition or a pathological condition, that can be avoided. For that, the only step is to maintain the circulation of the body, and that is possible to take Pitta Shamana drugs and procedures as a routine practice. There is so many very suitable, highly effective eye drops in Ayurveda, and also this type of suitable oil application on heads is seemed to be highly effective. So, once the pathology is already detected, then we can take remedial measures to prevent it. Just like any other disease, if the causative factor or the trigger factor is coming again and again, recurrence will be will be there. So, we need to avoid the recurrence. For that, so many food restrictions and some habitual factors to be maintained, then it is possible. Or in the case of diet, any sour tasted food items are seem to be a trigger factor. For example, the citrus fruits and this mango and its different varied types of preparations, and concentrated lemon juice, and other types of sour tasted, this curd, and then pure buttermilk. These are all trigger factors in the case of maculopathy. And other habitual factors are exposure to bright light and focusing on light source for a long time, and some physical exercise or these different types of physical movements in bend down position, head down position, postures, and these are very proved things to be a trigger factors. So, to avoid recurrence, we have to control these factors. If you are doing that way, then recurrence can be avoided in a good manner.